And we have in the studio a medical practitioner, Dr. Tuyi Mabawondu, to discuss this latest Ebola setback in Sierra Leone. Glad that you could join us. Thanks for being here. Now, first, Liberia. Now, Sierra Leone, just on the threshold of being declared Ebola-free. How did this woman go unnoticed, till she died?
The triad of Sierra Leone, Liberia fight. What happened is this: we need as much as we have achieved a lot in fighting against Ebola in the past few years, there are still some areas. Okay, the question is this: what is responsible for the persistent transmission of this Ebola virus, despite all the mobilization of human resources, equipment, and diagnostic skill? Now, first and foremost, the trust between the local people and the workers, people treating Ebola, there's still a fragile trust. You remember at a point in time there was actually a fight that broke out and riot on this Ebola thing. And two, the culture is clashing with the Ebola management system. Now, most of the time in African setting, you want to have a decent and dignified burial for the loved ones, actually when they're elderly. But we've not been able to really merge these disparities in terms of how do we now conduct a decent burial for somebody who died of Ebola and he's old and is an important person in the community. So that is there. And then there's still this small group of people. You can't really link them to a source of an Ebola victim. They just come out and there are new cases and you don't know where they got the virus from. So most likely this woman might be one of them that actually got diagnosed with got Ebola virus and probably not linked to any source. So again, those are the gaps. And then, of course, as much as the fact the health system has been thinned out and we have a lot of problems with the health system, yes, they are managing it. But again, there's the commissioning of most of the Ebola treatment units.
Let me take you let me take you up from the gaps. We are particularly concerned because Gambia has gone 50 days without a confirmed Ebola case, suggesting the possibility of an error. This is Cabo, the Chief Medical Officer, Sierra Leone, Brima Cabo, speaking. What do you make of this statement?
Yeah, again, in epidemiological survey, you cannot rule out some of those kind of errors. I mentioned earlier that there's still this tiny number of new cases that you cannot link to any contact. Okay, because normally you're supposed to have a contact with an Ebola victim before you pick an Ebola disease. Okay, but there's this few number of clients that you cannot link to any.
How can't you link?
Yeah, it can happen, but again, let's face it. First and foremost, tracing, because you cannot actually monitor a human being 100 hours, okay, or 24 hours. They might have gone elsewhere and just come back and feel that they're safe. That's an example. Secondly, they might have had contact with some other animals that can give them the virus. That's another example. So that can be a gap. That can be the reason why this woman just came up, And then two, you need quality epidemiological tool and people on ground to really go ahead and be able to look at this and monitor this very well. But for me, it's still a good case because, one, this woman is not escaping without them knowing. Okay, imagine if this woman had been buried and the people, they didn't actually do a test and confirm that she's positive. That means that the number of people that are put in a quarantine now would have escaped, and that would have been another big setback for the Ebola
this
fight. Clearly
suggests an error in the processes, doesn't it?
Well, it's not foolproof. Okay, all we're trying to do, if you look at the roadmap to stopping Ebola, first and foremost, you want to really stop the transmission of disease in the country or, even in any region. You want to pick new infection and treat them appropriately. You want to strengthen the health system, okay, which is a lot of things. You want to really encourage research into the cure of Ebola. And finally, you want to do collaboration among other people, among international and national borders. Now, the collaboration becomes so important. Now, we have the vaccine that's been deployed to fight the Ebola. This is a time to really push the vaccine. The Canadian variant of the vaccine is quite effective. This is a time to really push the vaccine now and move beyond, this surveillance only. We need to deploy the vaccine to those areas, especially the border areas between the Sierra Leone and Guinea, so that we would be minimize the contact and manifestation of disease in that area.
It's really interesting that they still had to test a dead woman apparently they're not taking any chances. That's quite interesting.
Yeah, that shows the level of carefulness that has followed the fight against the Ebola virus. Okay, now every death in that country must be tested for Ebola. We don't care if you have hypertension or what, but let's see, are you having Ebola virus with it? So that is it. That's the level of carefulness. And that is the thing that can really bring the result we desire, to have an Ebola-free Sierra Leone in the next, because now after the quarantine, 42 days, then after that we need to spend another 42 days to see if anybody is going to come out with Ebola virus. So it's thorough, and we cannot wish it away. And given the fact that the rainy season is coming, and it's actually around the corner, you're going to pick, there's going to be other diseases. Malaria is going to be on the increase, other diseases will be there, and then you have to deploy human resources to fight those diseases, and at the same time you have to fight Ebola. So the earlier we try to narrow the Ebola thing down to few cases before the rainy season, where when the peak of disease will happen, the better for the country and even the world.
Well, the Liberian Ebola resurface case was regarded as a sexual transmission. What can we possibly attribute this 67-year-old woman to?
Yeah, we couldn't. Now it's going to be nice if the woman was picked before she died. A lot of questioning could have happened. We could have been able to really trace and understand where the thing might come from. But we have to rely on secondary information now, especially from relatives, from close people around the woman. We don't know. Honestly, nobody knows. You know, if you observe, the woman had died 5 days
before they even noticed.
The result came out, and then, you know, that's actually, you know, a question, a gap. That's a worrisome gap, that you have to allow 5 days after somebody died, you know,
to go and test
before you
dead
test.
body.
That's a gap, and those are the kind of area that you need to narrow. Even for them to actualize complete isolation, it takes about 2-3 days, even for a newly diagnosed case. Those are gaps that need to be narrowed down. And before you can narrow this gap, of course, you need people on the ground. You need to really structure and straighten the relationship between the Ebola treatment team and the community. You need to take into consideration the culture of the people, and be able to really, you know, infuse confidence in them that all of us are in this together. We need to make those changes necessary so that our country can be safe.
Right, thank you very much to Mabawondu, a medical doctor, discussing the Ebola. It's interesting, that's, I'm afraid, what we're going to call it today. But it's interesting to know that the contacts of the woman have been identified and isolated. That's quite interesting. Thank you once again for being on TVC News.
Thanks for being here.